up.
Totally.
This is too important to make shit up. My name is Jeffrey Swisher, MD. I am an anesthesiologist and chairman of the Department of Anesthesiology at California Pacific Medical Center in San Francisco, California.
Hello.
Hi.
Hi, doctor.
Dr. Swisher, how you doing?
Good, I'm fine. How are you doing?
Nice to meet you, Dr. Swisher.
Can I just get straight to the questions for you?
Absolutely.
In comparison to past outbreaks, how long do you think this pandemic will last for?
That's a good question. I think probably this is going to last for at least through November, just based upon data from
November?
Yeah, I know, unfortunately.
Would that be until the cure is found, or is there a point where we can be able to go back into society?
I think it depends on the rate of infection in the community that you live. If you're talking about a vaccine, we're not going to see a vaccine for maybe more like 18 months. We're still very early on the up peak of this right now. We're not at the downside. So I think we're going to be isolated for quite a while.
What would you say to those who still say, this is just a flu, or the media is being alarmist?
Yeah, the media is not being alarmist. We have not been hit with the surge that Italy has seen. We're about 2 weeks behind that. But if you look at the rates, the rate of infections and also the mortality rate, we're tracking it at the same rate and maybe even a little bit higher than Italy is right now. If you look at the number of worldwide deaths now, we're starting to approach 10,000. That's a lot. And again, we're in the early stages of it in the rest of the world. So there's a very good possibility that we're going to be seeing, upwards of millions of deaths from this. That's not the flu.
My dad is a flight attendant for United, and he's 66, and he's still flying internationally, and I can't convince him to stop.
Yeah.
I don't know what you would suggest I say that maybe would give him a better perspective.
I would say that he should take all judicious care. I think he probably understands the risks as well, and I bet he loves his job like I love my job. I have an 85-year-old mom, and I tell her, do not go out. And it's hard for them to listen.
So I'm thinking about the food supply and maintaining that. The people who work in the grocery store, they have no protection. And in some ways, I wonder if they should close to the public and just employ shoppers who bring stuff out to your car.
Any mechanism that allows people to distance themselves, to decrease, like you said, the surge. That's the important thing. I mean, ultimately, this is a virus. It's a very virulent virus. Most everybody's going to get exposed to it. Hopefully, we'll get immunity. The hard part in this country is that we haven't had a screening test. So not knowing the denominator, in other words, how many people are infected, makes it a little difficult to predict.
I know healthcare professionals all over the world right now are working long and arduous hours, and it's only going to increase as more and more cases come out.
You're right. We're working really long hours. And I think if you look at some of the Chinese doctors that were in Wuhan, I was just on a conference call on Monday with 30 of these guys, and they look exhausted. There's no question about it. Yeah.
What is the general morale of people like yourself and your colleagues that are fighting coronavirus on the front line?
As far as the mood goes, I would say appropriately concerned and a little scared, and want to protect ourselves from getting sick ourselves, and definitely want to protect our families from getting sick from us. Now, most doctors, nurses, techs, people in the hospital, the reason we're in medicine is because we like helping people, and I think most of us are really willing to do what we need to do to make this go away.
Have you seen your casework or the type of work you're doing change or shift?
One of the big things that we're starting to do is we're repurposing ourselves, and I will have to probably go and staff an intensive care unit, so take care of people on ventilators. And we've taken measures, I would say, in a graded fashion since this whole thing started, to the point right now that we're not allowing people to come in with their families when they come in for surgery. So a lot of people are going in pretty scared without any support mechanism.
What's been the most heartbreaking story or experience for you amidst all this?
Well, having somebody I know contract this and be critically ill in the ICU, who I work with. And so when you see someone that is my age, I mean, he's otherwise was a healthy person, relatively healthy, now facing the possibility of dying, that really brings it home.
In what ways do you think the world will be different after this, especially for the kids of today?
Okay. Well, I think this is a somewhat of a traumatic experience for a lot of people. So I think that it's going to make a mark on a lot of people. I have a daughter who's a senior in college. She's my youngest, and she's not having a graduation ceremony because of this. And I think that we have to acknowledge that there's a lot of loss. The other issue that's going to be certainly long-term is economic. I think that a lot of kids are worried about that right now, college-age kids especially.
I am worried because I do live with two parents who are both getting old. I've heard from the government saying that we're going to have the shutdown until August, and a lot of families now are not having jobs at the moment, so they're not making income. Personally, right now, I just don't think we're going to survive until August because that's just too long.
Yeah, so you can go back to things like World War II when everybody really had to collectively give up a lot of things and all work together. And I think that is sort of where we're at right now. I think when this is all said and done, we're going to look at this as a really seminal event in American history, world history.
I feel like we are very individualistic, and it's hard to have a collectivist mindset when it comes to stuff like this.
Yeah, but it eventually it benefits all of us to be collectivist in this setting. And I think it's the hardest thing is to get people to get out of the mindset of about me as opposed to about everybody.
How are your supplies? Do you have enough masks right now? Are you having to ration masks?
No, we don't have enough supplies. And two, we're having to ration at this point. It's starting to get better. We're getting some donations from the community. Like yesterday, the Irish Contractors Union in San Francisco just donated us a whole boatload of N95 masks.
If people have masks, can they send them to their local hospitals?
Yeah, they can actually. There's hospitals have donation points. Obviously, what type of mask is important. And if you don't use equipment correctly, you can infect yourself. And clearly we're at the front lines and we're with people who are infected. So we have a very high rate of potentially getting infected unless we protect ourselves.
What is one thing that you wish the general public knew?
This is not fake news, number one. This is real. And that the most important thing you can do is to listen to the advice about social distancing. The more we can do that, the more we can flatten the curve and decrease the number of cases acutely. I don't know overall if they're going to decrease the number of cases, but what we don't want is having a surge at the hospitals that overwhelms the resources of the hospital. I think this is going to change our society, and hopefully that we will be more compassionate, that we'll care more about other people. I think that hopefully the goal is that we're going to be a better country as a result of it, even though it's going to be hard. I'm not saying it's not going to be hard. It's going to be hard.
Awesome. Well, thank you so much for your time and for answering those questions, and also for your service. I know it must be a tough time for you.
It's tough, yeah, there's no question about it. But I'm a pretty optimistic person. I'm a glass, half full type person. So I really think that we'll get through this.
Awesome. Same. Great. Right. Thank you.
Thank you for being on the front line, and thanks for taking the time. I really appreciate it.
Thank you. Thanks for doing this.
Thank you so much for carving out the time, Doctor. Stay safe, and thank you.
Thank you so much.
It was great talking to you.
All right. You too. Take care.